Hi, I'm Alexandra Gobble, and I'm a fourth-year medical student at the University of Washington School of Medicine. This presentation is on vascular surgery and how to apply to it as a medical student. I applied into vascular surgery this year, so I have some recent experience. Here is an overview of what this presentation is going to cover, starting with talking about what vascular surgery is, why I chose it, electives, timelines in medical school, letters of recommendation, how to be a competitive applicant, what fellowship opportunities mean in this field, and hopefully some helpful resources. So what is vascular surgery? I think that's one of the important distinctions in deciding what you're doing early is knowing what vascular surgery is. Vascular surgery is diagnosing and treating diseases of the vasculature that are outside of the brain and the heart. Diagnosing and treating means operatively and non-operatively. Arteries and veins are the vasculature. And while some vascular surgeons do neurovascular work, normally that's left to other specialties. Vascular surgery is pretty unique in surgical fields in the sense that we do both traditional open surgeries and endovascular procedures. So open surgeries being cutting, taking things out, putting things back together, and then endovascular procedures are those wire works where you're gaining access and putting catheters and sheaths into people to accomplish other tasks in the vessels, and that's becoming first-line treatment in a lot of cases. We're in this exciting cusp where we're deciding what's better for certain populations and certain diseases. They treat aneurysms, peripheral artery diseases, and dissections, and dialysis access, veins. All of those things are things that vascular surgeons treat. It's more unique in surgical fields because you have longitudinal patient care, and of course you have vascular traumas. An important thing to discuss when we're talking about what is vascular surgery and how do you go about becoming a vascular surgeon is speaking about the changes in how we're training vascular surgeons nowadays. So the traditional way of doing it is that you would have a 2-year vascular surgery fellowship after your general surgery residency, and then you would be board eligible in both general surgery and vascular surgery at the end of your time. But due to a lot of reasons, kind of moving towards the direction of plastic surgery is we're doing integrated vascular surgery residencies, where you'll be board eligible in vascular surgery only. So these training programs have been around for over 10 years. They're growing. It's definitely an acceptable way to train to become a vascular surgeon. And kind of the idea is you have more time for vascular specific training. Programs do require a certain number of months on general surgery services. There's a lot of skills that you'll use and that are really important to becoming a good surgeon, but at the same time, more time doing vascular specific things, so learning about how to treat diseases non-operatively, learning how to do like vascular ultrasound and how to read those, how to do endovascular procedures and that subset of skills which you don't use in general surgery, and then reading vascular imaging. So it's a more focused skill set where if you know you want to be a vascular surgeon, you don't have to necessarily learn how to be super proficient with laparoscopic tools because that's not a vascular skill set. And most of the programs are integrated with the fellows, so you'll have both a residency and a fellow like simultaneously, and you'll both be like, when you're a senior in the residency, you'll both be seniors and you'll be equals. But it's a really interesting way to learn from those people who kind of have this like other skill set and are kind of more mature in another way. They've been in training for longer, they've been a surgeon for longer. And I don't think most of the fellowship programs are going anywhere. Some places will trade out like a fellowship position, training spot, and exchange it with a integrated residency spot. But overall, I think they're both be around for a while, and so it's kind of deciding which pathway is best for you. And I think the best way to think about that is if you know you want to be a vascular surgeon, you should probably do the integrated residency. But if there's any doubt in your mind that that's truly what you want to do, you should explore the other options with the general surgery first and then doing the fellowship. A definite negative of doing this is, before, when there were just fellows, you had to have general surgery residents to help run the service. But since those spots are being taken up now on the vascular services by the residents, most of the general surgery training programs at the same locations, you get less time on those services, so you get less exposure to vascular surgery as a general surgery resident than you may have in the past. And then, of course, there's the time issue of most academic general surgery residencies now require at least 7 years, so you're adding more time onto that training, whereas it used to be 7 years to complete it all. You're probably realistically looking at 9 years, and vascular surgery residency programs vary from 5 to 7 years depending on if they require research or if there's an option of research. But these are really important things to think about when you're deciding what you want to do with your future. And bottom line is, if you know for sure that you want to do vascular surgery, the integrated residency is probably the way to go. If you need some more time to explore and to reflect and to think about other things and to consider other things, general surgery residency is there, and you can always do a fellowship. Continuing into the same vein of thought with the integrated versus the fellowship, especially since vascular surgery is pretty small, is to dual apply to general and vascular, or just apply into vascular surgery. And the answer is probably just apply into vascular surgery. The residency programs have been growing. There's a significant number of positions. So it's not like it was in 2010 when it was just first starting out. There are a lot more spots, and if you're a competitive applicant, you don't need to dual apply. In a lot of cases, if you were to apply into general surgery, it's very obvious that you're applying into vascular surgery because you have vascular sub-internships, you have letters from vascular surgeons and no general surgeons. And so your entire application is geared towards vascular surgery if that's what you want. Of course, you should be talking with your advisors and your mentors and upperclassmen about your competitiveness and if it's necessary for you to. But if you were to apply into general surgery and you had a good vascular application, you probably won't get a lot of general surgery interviews because it's so obvious that you want to. And if you were to go to these interviews, they would probably ask you if you're applying into vascular surgery or if you're even interested in doing general surgery. So if you do apply, and you do go to those interviews, you should be genuine in your interest there. The integrated residencies and the fellowships and the growing number of positions are reflecting the shortage of vascular surgeons that we have in the world, and particularly in the United States. For every one vascular surgery candidate graduating, there are six vascular surgeons needed across the country. I have a unique background among medical students in the sense that I have an engineering degree, and a lot of the same reasons that drew me to engineering are the same reasons I really like vascular surgery. There's numbers, there's compliance, there's flow velocities. It just makes my little heart happy. And there's also a wide variety of cases. In vascular surgery, you're working all over the body, you're utilizing all sorts of different techniques, you're working with all kinds of different other services and specialties. It's really exciting. We already touched on the longitudinal relationships with patients, but that's something that's pretty unique among surgical fields. You're following up with them. And a lot of the population that you see, it's pretty sick, it's an elderly population. I think that's a really rewarding one to work with. You are coming down the road to making these decisions on whether or not to do surgery and risks of procedures, and you get to have these kind of meaningful end-of-life conversations, and that's something that's important to me, and I think very fulfilling part of the field, and not something that you get everywhere, and you don't get those opportunities to make those connections with those people and have these conversations in a lot of other surgical fields. It's a very techie field. over the past couple of decades, vascular surgery has embraced all of these changes, including like endovascular and these devices, and being able to be involved in the creation of these and how we're looking at them and how effective they are and changing the field is something that really draws me to it and is exciting about looking forward to the future. So the specifics of vascular surgery practice. Residencies, we've already kind of talked about this, 5 to 7 years of integrated residency programs. The extra 2 years are purely for research. They're not any clinical medicine, really. Some programs require research, some programs it's an option. If it's an option, you want to do it, you need to tell them up front that you want to do it, because a lot of times they'll cover your spot with a fellow year while you're gone. Salary is variable depending on location. Are they in need of vascular surgeons? Are they saturated with vascular surgeons? And then if you're doing like academics versus community private practice or privatemics. And then in your actual practice, it'll be a mix of OR and lab. A lot of places will have a hybrid room if they're a large hospital, and then seeing patients in clinic. So you need to take some electives. What do you take? So you need to take a vascular surgery sub-internship. And the question you're probably asking is, do I need to do an away rotation? The answer is probably. There are a lot of advantages to doing this. So if you don't have a home program, you should be doing an away rotation. If there's a place that you'd be offended if you did not get an interview at, you should be doing an away rotation. If there's a place that you know that you want to go to, or you know is at the top of your list or near the top of your list, you should be doing an away rotation there. A lot of these programs only have 1 or 2 spots. So doing an away rotation there is going to express interest, and it's going to help you get to know these people and know how you work with them. So it's going to be a true way to see if you really fit in with the department and it's somebody that they want to have, representing 20% of their residency for 5 years. Obviously, they can be a double-edged sword. If it doesn't go well, or if you don't get along with those people, it's not going to be that great. Maybe you don't want to use those letters. But it's important to get those letters. It's important to know what you're looking for in programs, and it's important to know if you fit. And you can only get the best way of knowing is if you do an away rotation. Other things I'd recommend are surgical ICU rotation. Obviously, you'll be doing that, and there's a lot of important things that you do on those rotations. As a vascular surgeon, you will be reading a lot of your own reports for patients, so you need to have a basic understanding of radiology. Taking anesthesia, always important to know what's going on behind the curtain. And there's some vascular procedures that require anesthesiologists to do different things, so important to be able to relate to them and know if you're asking realistic things of them. And then surgery electives, so if you are planning on dual applying, you probably want to take a general surgery sub-internship as well, just so you are not only having vascular surgery letters. But there's, a lot of things. Just take what you want to take besides that. As a medical student, what are the things that you need to be doing to be successful? You need to be doing well in classes. Most preclinical classes are pass-fail, but get the things that you need to get out of them. It's a great time to explore different specialty options, be involved in interest groups, go and do shadowing, make those connections, and really find what's important to you. Get involved in service learning, get involved in volunteering, get involved in leadership, get involved in things that you're passionate about, but also importantly, get involved in research. If you know that you want to be a vascular surgeon or that you like this project or something comes up, there's so much that you get out of research, and in competitive specialties, sometimes it doesn't matter what field that you're in, just that you're doing it. Obviously, if you're a first-year medical student and you know that you want to be a vascular surgeon, get involved in vascular surgery research. Do well in your step 1. As we're moving into this post-step 1 world where it's going to be pass-fail in the future, I think that maybe the step 1 score will be less important, but still do well on it. If it's pass-fail, pass it. If it's not, do as well as you can. The cutoff score for a lot of surgery programs is a 230, so really try and do above a 230. It's kind of one of the great filters. It's just one part of your application, so if you don't do 230, just explore how competitive you are. It's not the end of the world. Do as well as you can. And in your third year, you want to do as well as you can on your clerkships, honors as many as you can. Particularly important to get an honors in general surgery and internal medicine. Do well on your shelf exams. If this is the time that you're deciding that you want to do vascular surgery, try and focus your research more on vascular surgery, make those connections, meet those people. And in December of your third year, you need to be planning your away rotations, deciding where you want to go. Your fourth year timeline is a little bit more condensed. I know some places don't have fourth year starting in the spring, but really you should be taking step 2 CK and CS early on. You want to do well on CK, probably get above a 240. Just do as well as you can. And then start your vascular sub-Is. This is where you'll be getting your letters of recommendation. Plan out your application early, update your CV, start your personal statement. In the summer, continuing with the away sub-Is, taking the letters of recommendation that you want from then, and ERAS opens. So it's important to have your CV ready so you can kind of copy and paste it into there. In the fall, you'll be submitting your ERAS application probably in early September. You'll be finishing your away sub-Is. Some people go through October for vascular surgery. I think it's pretty common. And then be ready to respond to emails after you submit after September 15th, but really after October 1st is when a lot of them will come in. Interviews will start in late October, and most are done by mid-January, but some of them will still go through February. And then you'll submit your rank list in February and almost be to the end. Who do you get letters of recommendation from? They should all come from vascular surgeons. Each program will require that you upload either 3 or 4 letters of recommendation, and you should research the program and see if they want 3 or 4. If it says 3, put 3. If it says 4, put 4. And you can mix and match. They don't all have to be from the same people. And you need to be asking for these letters when you do your sub-Is. You should have one from, your home institution at least. And if you come from a place that maybe doesn't have a large program, one of the good things about doing these away rotations is getting those letters. Some programs might request a letter from the chief of the division. Normally vascular surgery is under the general surgery department, and so the person in charge of the vascular surgery part of it will be the chief. They should come from people who know you well and that you've gotten to know throughout your time in medical school or that you worked closely with over your sub-I. And when you ask for these letters, you should offer to send them your CV, your personal statement, your board scores, and things like that. So what makes a competitive candidate for vascular surgery? It's kind of an all-around thing. There's not one thing that really does it. So just make sure and do well on your boards. If it's pass-fail, make sure you pass. If it's numerical, do as good as you can, but probably above a 230 on step 1, and as good as you can do on step 2. Really try and make it above a 240. Get good grades. If they grade your preclinicals, get good grades. If they don't grade it, make sure you pass everything. Try and get honors as many as you can on your clerkships. Get good letters of recommendation. Get them from people that you know. Get them from people that you feel comfortable around and that you've worked well with. Get them from people that are other people also know vascular surgery is a really small field, and who you know can be pretty important or get you interviews. Doing well on those away rotations and audition rotations where you're working with those people, especially since there's so few spots, is a really important way to make yourself stand out with programs. You'll also be getting letters of recommendation from people on these away rotations if you're doing them before September. And so if you come from a place that doesn't have, a very big vascular program, you can go to these other places and get good letters of recommendation. And then make sure that you have relevant research, presentation, and publications. Vascular surgery is already a subspecialty field. It is a fellowship in a way. And so there aren't really very many fellowships that you can do off of vascular surgery. You can kind of do like these mini fellowship programs where you can do an aortic, like an extra year or a couple of months of aortic work. And then you can also, you can do like little fellowships with well-known people or programs that they kind of like have a niche, and so you can work with them and they'll teach you skills, or you can practice in a niche yourself, doing like dialysis work or doing vein work or doing pediatrics. As early as you're thinking about it in medical school, you should be contacting your vascular surgery or general surgery advisors. The general surgery advisors, since vascular surgery is kind of a specialty within the field of general surgery traditionally, they're very helpful in kind of discussing those different paths and things like that. But also try and speak with your vascular surgery advisors if that's what you're interested in. And these are people that want you to learn more about it and to make the right decision for you, so no one's going to be offended or anything like that if that's not what you're choosing to do. But they're just trying to make themselves a helpful resource for you. At the University of Washington, the program director is Dr. Singh, and his contact information is available in our directory. But really, all of the vascular surgery faculty, if you meet them during VSIG or you're shadowing them, they're great resources to talk with about this. Also, getting involved in your VSIG is a good way to learn more about vascular surgery and make these connections. And then, of course, SVS has really good resources for medical students as well. Feel free to contact me if you have any questions about vascular surgery. Always happy to talk about it. My @uw.edu account will be active as long as I'm at the University of Washington, but otherwise please feel free to contact me at my Gmail that I've also listed. I wish you luck in your endeavors.